There was a time when feeling sad after loss was called grief, when restlessness in children was called imagination, when fatigue meant your body needed rest, not a pharmaceutical pick me up. But not anymore. Today, normal human experiences are being rebranded as disorders just to sell you treatments. Feeling overwhelmed? That's not a stressful life. It's generalized anxiety disorder. Distracted? Must be ADHD. Lost your appetite after a breakup? That's major depressive episode. And just like that, you're labeled. Then come the prescriptions. Antidepressants, stimulants, mood stabilizers, sleep aids. One label, a lifetime of chemical dependency. What used to be part of the human journey, ups and downs, fatigue, sadness, frustration, has now been pathologized. Why? Because a disorder is billable, a feeling is not. There's no profit in teaching coping skills, no insurance code for let's talk about your purpose, but there's a multi-billion-dollar market for medicating the symptoms of modern life. And let me be clear, I'm not dismissing real mental illness. What I'm calling out is the overreach, the medicalization of everything inconvenient, everything uncomfortable, everything real. We now live in a world where kids can't move without being labeled hyperactive. Women can't express emotion without being told they're hormonal. And men can struggle in silence without being told they're chemically imbalanced. But what if you're not broken? You're just human. And what you really need is nourishment, community, sunlight, movement, purpose. Not more pills. I've watched patients transform, not by numbing what they feel, but by understanding it, by detoxing their body and reconnecting to their soul. But that kind of healing, it's slow, it's unprofitable, and it doesn't come with a catchy ad campaign. So the system keeps labeling, and you keep believing that your feelings mean you're sick. But I'm here to say, maybe you're not mentally ill. Maybe you're emotionally starved, and maybe the cure isn't in a bottle. It's in remembering who you really are. Follow me, because being human shouldn't be a diagnosis. It should be a revolution.
This presentation represents the professional opinions, clinical experiences, and educational interpretations of Dr. Farah Agustin-Bunch. It is presented strictly for informational, educational, and motivational purposes only. Viewing, attending, or engaging with this presentation, or any content in any form created by, affiliated with, showing, or associated with Dr. Farah does not establish or imply any doctor-patient relationship with anyone. No personal medical advice is being given, and nothing in this presentation should be interpreted as individual medical consultation, diagnosis, treatment, or prescription. Statements made herein have not been evaluated by the U.S. Food and Drug Administration or any international regulatory authority. The experiences and outcomes shared are not typical and are not guaranteed. This content is not a substitute for professional medical advice. Always consult your licensed healthcare provider before making any health-related decisions. Copyright and content protection. This presentation and all associated materials, including video, audio, slides, graphics, and spoken content, are the exclusive intellectual property of Dr. Farah Agustin-Bunch. Unauthorized recording, reproduction, distribution, sharing, or public display of any part of this presentation in any format is strictly prohibited and may result in legal action. By continuing to watch, you agree not to record, screen capture, copy, repost, or transmit this content in whole or in part without express written permission from Dr. Farah or her authorized legal representatives. By continuing to watch, you acknowledge that you are solely responsible for your health decisions. You understand this presentation is not a medical service. You agree not to hold Dr. Farah, her team, or affiliates liable for any outcomes associated with the use or misuse of the information provided. Viewer discretion is advised. This presentation may challenge conventional beliefs and expose controversial topics in medicine, health, and regulatory policy. It is intended to empower, not to incite fear, replace clinical care, or offer medical guarantees. Your health is your responsibility. This is your opportunity to reclaim it.